Jen, and I'm a licensed athletic trainer and owner of Concentric Care here in Newington, Connecticut. If you've been around athletics, chances are you've seen an athletic trainer. But you can also see athletic trainers in other settings like the performing arts, working with the military, police, or fire departments, helping workers to reduce their chance of work-related injuries, maybe in a physician's practice, or owning their own practice like myself. Recognized by the American Medical Association as an allied health profession, athletic trainers provide compassionate care for all. So you're here to learn some injury prevention strategies, right? Let's get started. When it comes to recovery, sleep is absolutely vital for the body and for the brain. We think about how many hours we need, but sleep quality is just as important. So how many hours do we need? Well, about 7 to 9 hours is the recommendation for any athlete or adult. But again, it's a recommendation. Some people may need slightly more, while others may do well on slightly less. So what happens if we don't get the amount of sleep that our body needs? We know through various research studies that we can see a decrease in performance, reaction time, a decrease in accuracy, lower energy levels, strength issues, endurance issues, and an increase in craving of unhealthy foods. Why is it that higher level athletes tend to get less sleep? Well, there are some things that we can do to help our sleep strategies. It's called sleep hygiene. Sleep hygiene encompasses a few different tactics like having a routine, waking up at the same time each day, and trying to go to bed at the same time each night. Avoiding that blue light that we can get from things like our phone, iPads, TV, and computers up to 2 hours before bed. By having these routines in place, our body can prepare itself for sleep. Other things that might impact our ability to fall asleep might be things like caffeine, heavy intense exercise, and also your sleep environment. Typically, quiet, dark, and cool rooms are the way to go. Having a basic understanding of nutrition is essential for athletes. Start with things like macronutrients and calories before worrying about supplements or special diets. Unless you have a special dietary concern like celiac, gluten, or dairy sensitivities, it's critical that athletes obtain calories from all 3 macronutrients. Macronutrients. Think of them as the 3 fuel sources: carbohydrates, fat, and protein. When looking at the amount of calories that you consume during the day, it's recommended that 55 to 65% of your diet comes from carbohydrate sources, around 20% from fat, and around 15% from protein. Carbohydrates are the primary source of energy, super important when you change the intensity of what activity or skill you're performing. All carbohydrates get broken down into sugar. Sugar is the fuel of the brain and body. Fats are essential to the body also. They provide energy for longer, steady bouts of exercise. Protein is not technically a fuel source, nor would an athlete want it to be. Protein is a building block for cells within the body. Depending on your activity level, light, medium, or intense, and your body weight, you can actually calculate how much protein you need. More is not necessarily better. In fact, anything that you consume that exceeds what your body needs gets flushed down the toilet. So where do we get these macronutrients? Well, carbohydrates come from a variety of different sources, including grains, cereal, veggies, and fruits. Through digestion, those foods are broken down into sugar. That's what your body needs to survive. Now, I know what you're thinking. Sugar is bad, and you're not entirely wrong. The bad stuff, though, is added sugars, which you find in soda and sweets, for example. Can you think of foods containing fat? Well, hopefully you've thought of things like oils, like olive or canola oil or vegetable oil. Things like dairy products and meat. What about protein? I'm sure we all feel pretty comfortable knowing that our protein sources can come from animal sources, tofu, fish, eggs, beans. Always remember that your first choice should always be food. In fact, we call it the food first mentality. Talk to your doctor or a registered dietitian if you're concerned about getting the proper nutrients. According to UConn's Corey Stringer Institute, monitoring hydration status before, during, and after exercise is critical for both performance and safety while exercising. Proper hydration has been shown to increase performance, allow athletes to exercise at lower core body temperatures and heart rates, improve brain function, and has been shown to positively influence the body's ability to fight infections. How do you know if you're hydrated? Well, urine color is one way to know, but there are other tests that could be done by a doctor or your athletic trainer in certain settings. Also, weighing in before and then after physical exertion will determine weight loss. This indicates water loss through sweat. Dehydration is influenced by a few factors: how hard you're performing, weather conditions like temperature and humidity, and access to fluids while participating in physical activity. Since we're all built differently, hydration strategies should be personalized to each athlete's needs. It's important for you to be aware of your own hydration needs to maximize performance and safety. So, which is it? Sports drinks or water? Water should be the foundation of any hydration plan. Sports drinks or electrolyte-based fluids are only needed during intense exercise in hot weather, long duration, over an hour, or for athletes that are considered salty sweaters. When in doubt, drink water and start your hydration plan prior to practice or games. If you're feeling thirsty, you are likely already experiencing some of the negative effects of dehydration. For every 2.2 pounds a person loses, it equates to 1 liter of fluid loss or sweat loss. For example, if someone loses 5 pounds in 1 hour, their sweat rate is 5 divided by 2.2, which comes out to be 2.27 liters in an hour. Also, research suggests a similarity between adult and pediatric sweat rates. So coaches and parents still need to take responsibility for enforcing fluid intake guidelines in young athletes, because young athletes may not be aware of their actual fluid needs. foam rollers. Chances are you've used one, or your coach has told you to use one, or you've seen other athletes use one, and they can be really helpful. It is important to understand when is it appropriate to use a foam roller. So that means you have to have a good understanding of your body. And foam rollers can play a really important role in getting muscles that are really tight or overactive to kind of tone down a little bit. So what that means is I don't necessarily recommend just a head to toe foam rolling type routine. I recommend a foam rolling routine that is very specific and tailored to what your body needs. For today though, I'm going to show you a couple of variations of different techniques that you can use the foam roller for. So the first one we're going to start with is the spine. So the spine can be handled in standing or in a lying down position, or what we call supine. So because I'm standing, let's start with the wall variation. So if we're noticing tightness in kind of the lower back region and we want to have a technique to help loosen up the low back, we can get a foam roller up against the wall. And then with my feet, I make sure that I step away from the wall. And then I have the foam roller just above where my belt line would be on a pair of pants. Next thing I do for setup is my toes are facing forward. I prefer to cross my hands across the chest to expose the muscles of my back. And then I'll take a few more steps and I'll slowly glide on the wall, pressing my body weight into the foam roller. So for many of us, this is a great option, not a ton of pressure, so this is a great way to start out with foam rolling. So I'm hitting the low back. If I'd like to get a little bit higher, I can adjust my foam roller, still go with the arm cross, and now I've got some middle back. So we don't have to stay in just one up and down motion. We can certainly side bend if I find a good spot, side bend if I find another spot, and go from there. Just understand that everybody's body is different, so you'll have to make adjustments as needed. So you're looking for some more. So if our standing foam roller option didn't quite cut it, you can certainly try lying on your back. This involves allowing your full weight to kind of compress onto the foam roller. So here's how we set that up. Coming into a comfortable seat, I'm going to bring the foam roller right up against my body. I'm going to begin to lower myself back. Then, with the feet firmly rooted into the ground, I'll lift the hips, and this is step one. So step one, I could use the strength of my legs to roll through the lower back. I can play with the length of the roll here, so we can take some big rolls, or we can keep it relatively small. Just like we did in the standing variation, we can get higher in the mid-back region and allow the hips to sit back down onto the ground or onto your mat, and then you can move on to your next exercise. Been feeling some stiffness and tightness in the mid-back region? Here's some thoracic spine mobility techniques using the foam roller. So we're going to set up just as we did with the spine variation. This time I'm going to bring that foam roller a little closer to the mid-back, right beneath where our shoulder blades are. Keeping my hips down to start, I'm going to support my head with the hands. And then I'm going to allow my chest to begin to work its way towards the mat, opening up through the chest. Take a deep breath here and breathe out. Breathe in, lift the chest. Breathe out, arcing over the foam roller. Good. Breathe in, come on back up, and exhale, come on back. Sometimes I might even add a little side bending action, or it's perfectly appropriate just to hang out right here and take a few deep breaths to open the chest, to open into extension, and create a bit more range of motion. So whenever we're doing any of these techniques, just be aware that nothing should hurt. It should not be painful. Feeling kind of stiffness or kind of stickiness in the area just means that it might be an area that needs some attention. But again, never have any pain with these exercises. How often do I do it or how much? Well, that really depends. If I'm warming up and I'm using the foam roller to tone down some muscles that are overactive or to create some mobility, that entire routine shouldn't take more than 15 minutes, I would say tops. With that being said, you work into what feels good, and that might take 20 rolls, you might take 8 rolls. So play around with those numbers, but again, your marker is pain, and if it is painful, it might not be appropriate. You might need to kind of reset yourself up or see a health professional to help explain your setup, like an athletic trainer or a physical therapist. Let's continue our foam roller series with our legs. So starting at the most distal part of the lower extremity, that would be our calves. So one way to set up the calves is to be seated on the ground, and you can work one leg or both at the same time. So for today, I'm just going to work one leg at a time. I'm going to use my hands behind me as if I'm almost setting up for a crab walk. Lifting my hips up off the ground, I'm just going to roll the length of the muscle. We can go with shorter rolls or the full length of the muscle. And then you might notice I'm turning my toes in and turning my toes out. Okay, this is a great way to hit the muscle at a few different angles because those muscle fibers do run in kind of a complicated way. So more efficient, hit it from a few different angles, and you'll definitely feel the positive effects. Moving up the leg, let's get into the hamstrings. So the hamstrings are made up of 3 different muscles, and much like the lower leg, we want to change the direction in which we roll. So this is a good option if the hamstrings are feeling really sore. It feels good, and it helps to promote some blood flow in the area. Here we go. So one leg at a time or 2. I'm starting in a seated position, using my hands for some stability. I'm going to lift the leg, lift the hips, and I'm going to roll through the length of the hamstring muscle. So I'm kind of right in the dead center. I'm going to turn my toes out, getting the outer aspect of the hamstring. And then turning the toes in, I'll be able to focus some attention on the medial aspect of the hamstring. Awesome. Good job. All right, let's get into the hips, everyone's favorite. So if you're familiar with the figure 4 variation, you can absolutely accomplish this foam roller option, and it's going to seem pretty familiar. So crossing one ankle over the top of the other knee, I'm going to favor that side. So I'm going to tip the entire shape towards my left since I have my left crossed over my right. So slight tilt to one side. This is my base position here. And then I'm going to use hand and foot to shift my weight back and forth. So you can certainly switch it up, move a little bit until you find a really good spot. Tenderness is typically what you're looking for. So if the muscle is tight or overactive, it's going to let you know, because as soon as you put pressure on it, it is going to definitely communicate back up to your brain, holy moly, what are you doing to me? So we're going to work through this area. And again, no specific number, go by feel. And when it starts to feel that it's not as tense or as tight, you can move on to the next area. So while I'm here, I'm going to set up for the IT band. IT band, if you've done it before, you know that the IT band foam roller technique is pretty intense. One of the things that I'd like to point out is that in many cases we are setting that up wrong. So I'll talk anatomy in a minute, but I'm going to show you, since I'm already here, how to set this up. So my bottom leg is extended. I'm going to turn my entire body onto the side, and I'll take this leg and bring it over. So I'm going to drive through this foam roller exercise with this leg and arm, and I've got my foam roller right under the hip. So you can feel your hip bone, and you want to adjust it below. Now, this is where anatomy comes into play. the IT band runs straight down the side of the outer thigh. The thing about that IT band, it is so thick and so fibrous that by rolling directly on it, we're not making any tissue changes. We're not breaking up fascia. We are not making the IT band looser, all right? We have to understand that first because of the tissue properties. What we can do when we want to roll out the area is roll out kind of the medians of the IT band, the outer edge and the inner edge. And those little junctions of tissue is where we can make the most benefit happen. So my toes are facing you. This is exactly on my IT band, and I can already tell you it does not feel good. So I'm gonna lift my leg and turn my toes. And as you can see, they're turned up towards the sky. I'm hitting the kind of the outer border of the IT band where it runs into my hamstrings. Is it uncomfortable still? Yes it is. But it's way more effective than trying to press my weight onto the foam roller and just kind of crunch on that IT band tissue. So toes are up, then I'm gonna switch it up and turn my toes downwards. So as I turn downwards, I have to adjust my upper body, but I'm now getting that kind of area between the IT band and my lateral quads. So we'll work that area. Again, still uncomfortable, and that's okay. Uncomfortable and straight up pain are two different things. So uncomfortable, we can work with that, but it should not be painful. IT band takeaway message is not to roll directly on it, but roll just in front and just behind to get the best benefit. All right, let's talk about using the lacrosse ball. Chances are if we play a sport, we've seen other athletes or maybe a coach recommended that we get a tennis ball, a lacrosse ball, or something in that category to help with mobility work. So I've got my lacrosse ball. You can find it at any sporting goods store or any online retailer. And today I'm going to use this lacrosse ball for my feet. So why would we use this? Well, a couple different reasons. If maybe we have been out of training for whatever reason, maybe it was an injury, maybe it was COVID-19, we're getting back into running, or we're getting back to wearing cleats. Sometimes the arches in the feet can get really tense and tight, and we want to prevent something called plantar fasciitis. If you've ever experienced it, it does not feel good. It feels like a deep stabbing sensation in the arch of the foot. So one thing that we can do is use a lacrosse ball to work the tissue on the sole of the foot. It keeps things nice and loose, and it just feels good. So we can do this seated or standing. I'm going to show standing today. I've got no socks, no shoes, and lacrosse ball right in the center of my foot. So I can choose how hard I press, how light I go, but I'm just running through the arch. Now I have a lacrosse ball which has a little bit of texture to it, but if you're using something else, you want to make sure that whatever surface, if it's a kitchen floor or tile, it's not going to run away on you. So I'm changing the direction of my foot. I'm splaying my toes out. A little bit of a different sensation. Try the other side. And you can even crunch your toes in. Different sensation there. Splay the toes out. So play around with it, but using the lacrosse ball on the soles of the feet is really a great option to kind of keep that fascia nice and pliable, and it's wonderful particularly if you are dealing with an ankle injury or a lower body injury. It helps to keep that mobility up to par, and otherwise give it a go and see what you think.